Hello, this is Dr. Do again. This video is continuously with the streaming of systemic approach of medicine. It is ascending level from the invisible organic compounds and their metabolism and their function, and also diseases associated with this form of organic compounds, and move on to the level of cells, and then ascending up to the tissue, which becomes visible. And I mentioned 4 major tissues and associated diseases. Use some typical examples, either quite be serious or could be common. And then move on to the organ system level, ascending up. It's like stairs laying out in that level. And then I start talk about the skin as an organ, and also as a system integument, and also integumentary system and musculoskeletal system. And move on. Today I'm going to talk about internal organs and the system. First of all, I'll talk about the center respiratory system. So this is the respiratory system. It's so important because that's the communication using the environment resource, using the nature resource, oxygen, to sustain life. That's so critical. And the major organs of this respiratory system, I think you know it. Lung, and also affiliated with the trachea, bronchi, and nasal, oral cavities, and pharynx, larynx, and then going down to the lung. And I have talked about the lung structure and typical lung diseases. So this is how the system is organized into the respiratory system. In terms of, first of all, I usually like to talk about this as an isolated system. Its function is so important. At the same time as the integration of the whole organism as a body, respiratory system associated with other systems, associated with other organs or systems. For example, you know it, associated with the cardiovascular system, the blood circulating in the blood vessels, red blood cells, to carry the oxygen. So the lung to exchange the gas, and then carried by the red blood cells circulating to the blood and sent to the peripheral organ. This is the major integrations and connections, or the relationship between this system to the others. And also, actually, lung can serve as an organ involved in the blood vessel or blood pressure regulation. Angiotensin, for example, it's involved in during the synthesis process, involved in the lung. So, and this angiotensin not just only associated with the cardiovascular system, also the renal system, and regulate the blood pressure. So this is another important function of the lung. On top of that, of course, the oxygen is really so. The respiratory function provide oxygen to all the system, all the organs, all the cells, in order to do the regular metabolism and the function. So this is about the respiratory system. Let me just bring up the typical and the common, start from the common conditions. Of course, you know it. It's very quite common, particularly in the season, upper respiratory tract infection. I have my previous videos talk about this upper respiratory tract infection. It can occur in all the age groups with predilection of the two end, like either too young or too old. That's have more risk to get this disease because of the natural process. I think the immune function, and also the upper respiratory tract infection could be caused by virus actually, and occasionally, particularly in children, can be complicated by the bacteria. So this is the usually, and I previously mentioned about the bacteria versus viral infection. Talk about the signs, the severity, and also the management. They are all different, but in general, particularly for the young children and older people, this viral-caused upper respiratory tract infection tend to to be complicated by the bacterial infection. So, regardless if your children has younger than 5 years old, particularly younger than 2 years old, has this faded temperature. I mean, the temperature cannot brought down by the medications, and the child feel like lost the regular activity, and if the infant lost the strength to suck milk, it's central. And also these are all the signs like coughing, nasal discharge, and also sometimes the cyanosis from hypoxia. So these are all the signs. Particularly, you need to see the physician as soon as possible. And for the older people, probably just a simple viral caused upper respiratory tract infections, common cold, for example, and then further developed down to the lung, causes could be life-threatening pneumonia, particularly in these older people with comorbidities, some other diseases. So this is about the upper respiratory tract infection. Could be very minor, nasal congestion for a couple of days, or coughing for a couple of days, and then it's gone, recovered, or could be very serious into the pneumonia. So regardless if you have those, regardless your age or whether you're healthy or not healthy, if you have those kind of symptoms, coughing, nasal congestion, a fever cannot brought down, or chest pain, difficult breathing, you need to see a physician. Even though you think I'm young, or if you even though you think I'm, regardless young or old, I'll be healthy, just like I had it before, going to recover. However, if the symptom is not as what you had before, go to see your physician. So this is about the most common diseases associated with the respiratory system. Asthma is another common one, particularly in young people actually. And the risk factor for asthma is childhood, remote lung infection, pneumonia, bronchiolitis, particularly either by viral or by bacteria, causes this, particularly if those children had this bronchiolitis and involved in the respiratory support to or hospitalized, which means very serious. So if those patients really had increased risk of asthma during adulthood. So this is the asthma is so common. I think I don't need to talk about that too much in terms of mechanism, the treatment, and also in terms of the symptoms. The message I like to talk about this asthma is for those probably you have very mild and you have beta blockers, your physician prescribed to you, no beta agonist. Pardon me. If you have those medications to dilate your bronchi, just in case, and then you thought you did not have it for a long time, and then you do not carry it with you, and suddenly either exercise or some upper respiratory tract infection, you cause this wheezing, and you do not have medication. That's the scenario I'm going to bring up here. If that's the case, there's no choice. You have to go to emergency or see your physician as soon as possible to get this bronchodilator to open it up to just unsafe side, or otherwise it's carried. Even though you do not have it, you do not have this episode of asthma for a long time, but you had a history, and you make sure you had your prescribed medication renew regularly just in case for the safe side. So this is a message probably can be extended further, but I'm just going to stop here today, and thank you for watching. I will see you next time.